Have you ever wondered if your pregnancy was term? Have you ever kind of heard the term from your OB provider at all? So, when you're entering a new pregnancy, has your provider ever asked you, hey, was your prior delivery term or preterm? Is it kind of confusing as to what those terms or the terminology might be? It is definitely a question that I get a lot as a maternal fetal medicine specialist. So, today we're going to try to talk about what is considered term. Welcome to the Dr. Lexi Show, where I break down pregnancy topics into simple terms with the goal of helping you to learn how to advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy physician, and today we're talking about what is term. The way that I typically do these formats is EDI. So if you've watched any other YouTubes, you're probably getting into that format a little bit. E is going to be about expanding your knowledge. So we'll try to learn a bit more about the topic. D is on developing skills. So learning how to ask your provider certain questions and ways in which to advocate for yourself during your pregnancy. And then I is for impact lives. Everything that we're doing with any of these videos about breaking down pregnancy topics is to try to help anybody out there that is pregnant or planning to become pregnant learn how to talk to their provider better so that they can advocate for themselves and their pregnancy. So we're going to go through each of those kind of pillars or steps as we go along. So to start with this, let's go with E first, so expanding our knowledge. So let's think about some of the terms that are involved with expanding your knowledge. So what I'd like to tell you too before we fully get started is that you are always welcome to go to the website, drlexihill.com, and you can get more information there. What I would recommend at some point in time, you have a free download that I'll supply to you, and it is found at drlexihill.com/advocate. And this is going to be 13 questions that you can ask your OB provider across the board that are super, super helpful, whether it's about your due date or not. But this actually helps you along with this topic to just ask the right questions to your provider along the road during your pregnancy. The other thing is a free download with regard to looking at a term gestation, and you can find that one at drlexihill.com/term. So you have those two free downloads. I'll also share with you along the way some different links that I recommend. They'll be below as well in the paragraph so that you can go to those. I do think it's great to have wonderful resources that are kind of vetted by somebody in the medical field so that you know when you're online and you're looking at different resources that you know that they're considered a good resource to look at with regard to topics surrounding your pregnancy. So now that we've talked about that, again, let's get into this expanding knowledge. So where do we get this term from, right? So whenever we're talking about a pregnancy, we look at individuals when they come to us as a provider in the obstetrical world, and we always ask your obstetrical history. So you might have your provider say or ask you to fill out information regarding all of your prior deliveries. And there's probably little boxes that you're having to check whether your delivery was term or preterm, or you're asked to write down how many weeks you were when you delivered. And that helps us to stratify your risks in a future pregnancy for the possibility of a preterm delivery. So now that we've kind of thrown around that terminology of term and preterm, let's talk about exactly what it is. So if a delivery occurs before 37 weeks, that's considered a preterm delivery. If a delivery happens at or beyond 37 weeks, that's considered a term delivery. Now, if you're watching this as a patient, a pregnant individual, you're like, okay, that's simple, that's good. If you're watching this as someone who is an OB provider of sorts, you're like, wait. There's also different definitions of term, and that is true. But the long and short of it is if you're 37 weeks and beyond at the time of your delivery, that is considered a term delivery. So for example, if you're pregnant right now and your prior delivery was at 38 weeks, you've had one prior term delivery. If your prior delivery was prior to 37 weeks, you've had a prior preterm delivery. Okay. And that's just so helpful for your OB provider to say what they would recommend during this current pregnancy. Because individuals who have a prior preterm delivery due to preterm labor will have different recommendations for those who have a prior term delivery. So now we know that definition a little bit there. The other things that people can get confused about too when you talk about term versus preterm are those that may have had a loss of a pregnancy prior to 20 weeks. So we generally use the terminology there of a miscarriage. You've also probably seen or heard the word stillbirth, and data and research is kind of on the ebb and flow and back and forth as to when you call it a miscarriage or a stillbirth. But in general terminologies here, if we're talking about a preterm delivery, by definition, it really would be something typically from 20 weeks until 36 weeks and 6 days. Now, the part that is interesting too is preterm. Remember, we said that's prior to 37 weeks. There can be early preterm and late preterm. So that's getting into the woods a lot. But just to help you understand, term is 37 weeks and beyond, 37 weeks and 0 days. Okay. So those are some of the things that I wanted to just expand your knowledge on. So now you know some of the topics. Now we get into a little bit of the second portion of the EDI pillars, which is developing skills. And within this, with regard to this topic of the gestational age and how far along you are and when you have a term pregnancy versus a preterm pregnancy, which really is term delivery versus a preterm delivery. That's the part that's the most important of understanding this terminology, is if the delivery happens before 37 weeks or at versus beyond. So the terminology of a lot of this is just interesting because if we're talking about 37 weeks and beyond, that's considered term. Okay, so you can use that in I'm currently term, meaning my pregnancy currently is 37 weeks or beyond. You can also utilize it for explaining prior deliveries. For example, my delivery happened at term because I was after 37 weeks. So great vocabulary there for expressing it. And then when we're getting into, again, the developing skills, what kinds of questions can you ask your provider and how do you phrase these questions? So a lot of them can be discussing, when I am term, what is my plan? So when I'm moving forward, is there going to be a need for more visits? Am I coming to see you more frequently? Sometimes when people pass a certain threshold during their pregnancy for the gestational age, they might see their provider more frequently. The other thing is for individuals who need fetal monitoring. For example, they have a pregnancy that might have a slight higher risk of stillbirth. They might need to do antenatal testing, also called fetal well-being testing, also called fetal monitoring. People call it various things. So when you get past 37 weeks, when you're basically considered term during your pregnancy, you might have some changes with the follow-up and your OB provider's schedule. So you might want to say to them, hey, when I hit term, when I'm 37 weeks and beyond, does that change anything I need to do for my obstetrical visits? Do I need to come in more frequently? Yes or no? If so, what does that look like? So that's part of the developing skills surrounding term. The other thing is you're able to develop skills with regard to your prior pregnancies. So you're able to talk to your provider about prior deliveries and if they were term or not term. Then that gets you into the ability to be able to talk to your provider about, okay, I had a delivery, it was prior to 37 weeks, and now let's talk about, was it a spontaneous delivery? So if you delivered prior to 37 weeks, did you go into labor on your own? And that would be concerning for spontaneous preterm labor that then led to spontaneous preterm delivery. So that's one way to look at a delivery that happened prior to 37 weeks, and that warrants discussion with your provider. The other thing is for deliveries that happened for individuals in the past that were preterm, so prior to 37 weeks. What if they were indicated? Meaning, hey, I didn't go into labor, but my prior provider induced me or told me I needed to deliver my baby at 35 weeks. And if you can say to your new provider why that happened, that is a skill that's important to develop as well. For example, my prior pregnancy, I was induced at 35 weeks because I developed cholestasis of pregnancy, which is a condition where you have a lot of itching on your palms and the soles of your feet, and it can be dangerous for a fetus. And so sometimes those cases warrant early delivery. What if you had really bad high blood pressure and they couldn't control your blood pressures and you got preeclampsia? You might have been delivered early for that. So if you have a preterm delivery, developing the skills surrounding why that delivery was preterm, meaning did you go into labor on your own or was something going on that required you to be induced early or delivered early? These are things that would be fantastic to know about your prior pregnancy, to then advocate for yourself, ask the questions, provide that information to your OB provider so that you can have hopefully the best outcome for a current or a future pregnancy. Then we get into our last portion, our last pillar of the EDI, which is impact lives. And so the whole point of learning bits and pieces of pregnancy vocabulary, and for me trying to break down the information surrounding different pregnancy topics, is ultimately so that you can have a positive impact on yourself and your pregnancy. So the impact I think that individuals can have with this is the impact in being able to talk to your provider and hopefully make a current or future pregnancy have a better outcome if indeed you had a prior pregnancy that was preterm or that you ultimately had to deliver prior to 37 weeks. Individuals who have experienced any type of preterm delivery probably know the neonatal ICU well, and we call it the NICU for short. And our goal as providers is to try to get your pregnancy as close to term as we can. And if we can, that ultimately generally has a better outcome for the neonate because they were able to stay inside the uterus longer, get their lungs developed, and come out at a good weight, kicking and screaming, right, when they're nice and pink when they come out. That is the goal. And that's part of this impact is that if you learn some of these terms, like the term, right, and you understand what that's about, you can not only advocate for your current pregnancy, but also for future pregnancies by being able to communicate better with your provider with regard to some of this terminology. So now we've gone through the E, the D, and the I. We've expanded our knowledge about the definitions that surround the term. We've also developed some skills on why it's so important and what questions that you can ask your provider and what discussions you should have with your provider regarding the gestational age of your current pregnancy and prior pregnancies and how that can affect your care and management. Finally, we've looked at the impact that you can have on yourself and your pregnancy by knowing some of this information and really being able to talk comfortably with your provider and learning more about the terminology that we've been discussing today. I'll leave information below for 2 different links that you can find that have more information regarding the terminology or the term. There's one with some frequently asked questions that can be very, very helpful, and also some information that links to the March of Dimes, which is a large organization that can be very helpful in providing information to the public and also is a great place to go if you're looking into having an impact within your community and looking for any resources as well. Also for any items if you want to share your story or read other stories from individuals on their possible history of preterm deliveries and anything going on within your community on a national level, on a state level, March of Dimes is a really good place to go for extra information. Don't forget to leave any comments below regarding today's episode. Also, feel free to leave any comments for future topics that you would like to hear. Don't forget to download your 2 items that are free at drlexihill.com/advocate for the 13 common questions that you can ask your OB provider, as well as some information with regard to the definitions we discussed today for term delivery, definitions surrounding that as well. And you can find that at drlexihill.com/term. Thank you so much for joining me today. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.